Welcome to the section of Microbiology of Pathology and Laboratory Medicine. Who are we? We focus on detection of bacterial, viral, fungal, and parasitic agents contributing to the infectious process, determine the susceptibility of microorganisms to various antimicrobial agents, and report the results to healthcare providers. We use a broad and complex range of testing methodologies, including culture and non-culture based methods, syndrome-based sampling and molecular testing, as well as extended automation are major improvements in the clinical microbiology workflow. What are the roles of a clinical microbiology laboratory? The major role of a clinical microbiology laboratory is to diagnose, prevent, and treat infections. A porter brings CSF and blood specimens with the requisition slip for CSF-DR, CSF microscopy, STAT, CSF culture, film array meningitis, and blood culture. The processing bench technologist with proper personal protective equipment receives the specimens and enter into the ILMS.
Dr. Seema, there is a CSF smear for your review. Can you please come and check it?
The smears are quickly reviewed and numerous pus cells with gram-negative diplococci are seen.
Hello, Dr. Javeria.
Yes.
The CSF is full of gram-negative diplococci.
Okay. I am coming. I am going to review the slide. Okay. Yes, it is full of gram-negative diplococci. I think this is a critical result. We need to inform the clinician right now. Okay.
Simultaneously, film array results also turns out positive for Neisseria meningitidis.
Film array is a test by which 14 pathogens causing meningitis or encephalitis can be detected within 1 hour based on PCR, right? So, since this is Neisseria meningitidis, it is an organism which can spread very easily. So, you need to inform the clinician about putting the patient on contact precautions and any contacts on chemoprophylaxis.
This is Dr. Ali Raza from Microbiology. Is this your patient MR number 1234567? Neisseria meningitidis has been detected in your patient sample. Please make sure that you put the patient under contact precaution and all contacts on chemoprophylaxis. Thank you.
It takes at least 24 hours for organisms to grow and the plates are opened in BSC as there is a risk of exposure to laboratory personnel. Biochemical tests are performed to identify this organism and results will be finalized in 48 hours. At this point, antimicrobial therapy is reviewed and infection control precautions are discontinued. Reporting to public health authorities. Clinical microbiology laboratories play an important role for success of antimicrobial stewardship programs and aid physicians in providing optimal antimicrobial therapy to the patients, prescribing the right antimicrobial regimen to the right patient for the right period of time, and avoiding unnecessary antimicrobial use. Clinical microbiology laboratories conduct surveillance on local antimicrobial resistance trends among microbial pathogens. The collection, organization, and communication of resistance data culminates in the creation of an antibiogram. The antibiogram provides critical information to ASPs and prescribing physicians on institutional susceptibility patterns. When physicians treat patients with presumed infectious diseases, they must consider which microbial pathogens are most likely to be involved given a patient's history, severity of illness, and location of suspected infection. They also must consider which antimicrobials are most likely to cover those serious pathogens and prescribe accordingly. Antibiograms help them choose most effective empirical treatment. Point of care POC tests. Attempts are underway to move diagnosis nearer to the patient so that less skilled staff can use simpler, automated equipment that will enable faster, unambiguous diagnosis at the bedside, so reducing morbidity, mortality, and reducing the need for empirical antimicrobials. Such tests are developed on different platforms, but nucleic acid technologies are providing the greatest potential, especially in multiplex format, to provide rapid, sensitive, and specific results. Several such tests are already in use for the POC diagnosis. Example: malaria, HIV, HCV, syphilis, measles, respiratory viruses, especially influenza, norovirus, and tuberculosis. Role in infection prevention and control. The identification of healthcare infections is a combined responsibility of clinical microbiologists, IPC professionals, and physicians and nurses. While clinical staff will first note infection in an individual patient, microbiologists will confirm the suspected or actual microbial causes. She or he will often be the first to identify possible clusters of infection in a ward or in different wards. Alert organisms are mostly multi-drug resistant organisms such as methicillin resistant Staphylococcus aureus, MRSA, vancomycin resistant Enterococcus, VRE, multi-drug resistant Pseudomonas aeruginosa, multi-drug resistant Acinetobacter baumannii, multi-drug resistant Mycobacterium tuberculosis, extended spectrum beta lactamase ESBL or carbapenem resistant Enterobacteriaceae, CRE. These organisms are informed to the physicians and isolation precautions are taken. Outbreak recognition. The first role of microbiology laboratory is early recognition of a cluster or outbreak. This can be achieved either through the laboratory information system, which has incorporated an early warning system, examining rates of test ordering or rates of positive isolates, or through routine observations at the bench and comparison with the baseline incidence. Immediate communication with ward and infection control staff, from further case finding to identification and typing of causative organisms. The microbiology laboratory plays a critical role. Communication is key. Effective communication between the clinical microbiology laboratory and prescribing physicians is essential for optimizing antimicrobial regimens and delivering safe patient care. This communication may take several forms, including verbal and written test results reporting. It is imperative that reporting be timely, clear, understandable, and accessible to prescribing physicians. Laboratories should have procedures in place to ensure effective communication, and these procedures should be reviewed and updated regularly.